Though deaths and hospitalizations for COVID-19 infections have stabilized, the CDC says as many as 4 million Americans are living with long COVID. As more is learned about the long-term effects of the illness, one Bloomington therapist is working to help people cope. Benta Bouthier reports.
Bloomington clinical health psychologist Linda Brown has treated people with unseen illnesses for years. She saw reports of COVID-19 infections and persisting symptoms in 2021.
I thought, oh, wow, if the numbers are going to be like that, they're going to be really big here in Indiana. And maybe a group like the group that I've been running for women with invisible illness will be needed.
She started the first round of an online group this year, specifically for people living with long COVID. She teaches patients to advocate for themselves and to use energy management techniques. The U.S. Department of Health issued guidance that long COVID can be a disability under the Americans with Disabilities Act in 2021. But Brown says not everyone has access to the health care they need to start making a recovery.
I've had people that I've worked with who have said, I went to my doctor and said, I think I've got long COVID, and they said, oh, I'm not really finding that to be a thing. And of course that was devastating to the person I was working with, because he was suffering a great deal, unable to work, unable to do anywhere near as much activity as he used to.
Susie Smith is one of Brown's patients. She had to stop working after her second bout of COVID. Since 2021, she's had shingles twice, Bell's palsy, extreme fatigue, and seizures.
Nobody was talking about long COVID yet, but I was having these bouts of fatigue that were keeping me out of work for a couple of days at a time.
That was huge for Smith, who used to juggle work at a law firm, exercise, and taking care of 5 kids. She got her law degree from IUPUI in 2017 at 33 years old and wasn't ready to put her career on hold. Because of the seizures, Smith hasn't driven since August 2021.
I'm supposed to be the caregiver. I'm supposed to be the one that does everything, and so it's really, really hard.
She and her family kept looking for answers, but ready access to doctors and treatments aren't quickly available in Ladoga, where she lives.
It took from all of 2021 until about November when they started popping up with these long COVID clinics. And I was like, I need to get into one of those. I need to see if that's what's going on, because I wasn't ready to just stop my life.
At Cleveland Clinic in 2022, she was diagnosed with chronic fatigue syndrome, which her neurologist says is a result of COVID.
I got put with a support group of people who have long COVID through Linda, and it helped me to understand I have a baseline, and if I push, it's like these illnesses push right back at you.
Now she stays home doing chores when she's able, caring for the dog her husband got her. Her seizures have subsided some since. Another of Brown's patients, Yvonne Thompson, also had to stop working after she got COVID in 2020.
I had difficulty going upstairs. My heart rate would just out of nowhere get erratic, skyrocket, and I just had this horrible fatigue, and I ended up on FMLA.
A cardiologist diagnosed her with COVID postural orthostatic tachycardia syndrome. Thompson is grateful her physician took her seriously and that she was able to access specialists to help her get better. She had to devote herself to decreasing inflammation in her body, eating on a strict diet, and limiting her social and workloads. Now Thompson can work part-time. Thompson and Smith describe themselves as caretakers and community members who were always on the go before.
My 2019 self versus my 2023 self, we're different people.
Thompson says mental health counseling with Brown has been essential to her treatment, dealing with the PTSD and grief that came with her illness.
There's some stigma attached to saying, oh, you have PTSD because of a virus. And it's not like an event that caused the PTSD. It's the actual physiological impact this virus had on my body and my brain that caused this response. And I had a hard time wrapping my mind around that.
She thought PTSD just affected people who had served in combat or had been victims of terrible crimes. Smith wants treatment for long COVID to be more personalized to its wide range of symptoms. Brown says more multidisciplinary clinics should open, so that people living with long COVID don't have to seek treatment so many different places.
It may be helpful if everyone is aware that there may be people in their social circles who are silently living with long COVID. What to do about that? I'm not sure, other than be as open as possible to talking to people who have had COVID and are reporting lingering symptoms. Otherwise, I think we're still figuring out how to deal with this.
For Indiana News Desk, I'm Ben Taboutier.
Brown has a second round of the group meeting now with 7 members and will be taking more patients for a third round of the group in September. We're joined now by Dr. Sean Granis, the Vice President of Data and Analytics at the Regenstrief Institute in Indianapolis. Dr. Granis, what do you mean when you refer to long COVID?
Sure. As we all know, most people with COVID-19 get better within a few days to a few weeks after the infection. But some people, a small portion, have symptoms that last for 4 weeks or more after that infection. And that's when we start looking for the symptoms of long COVID. Anyone who was infected can experience it, and we're still trying to understand what that portion or prevalence is.
What is the treatment then?
So right now, the typical treatments are symptomatic, meaning that if you're having breathing issues, we tend to look at what are the typical respiratory treatments that might make sense, maybe similar to asthma. If you're having chest or joint pains, we think about treating that along those lines. We're still trying to understand what those underlying mechanisms are, and that's the focus of a lot of the research right now, is to better understand clearly the cause so that we can get at the best treatments.
Was one strain of COVID more likely to lead to long COVID than others?
So what we know is from the best studies so far, and the research space continues to evolve, we know that different strains could all cause long COVID, but we would see different symptoms. So for instance, we know that Omicron tended to demonstrate more fatigue. We saw that myalgias were the original wild type strain would cause muscle aches, sleep difficulties. We see more with Omicron. So different strains seem to have different prevalences, but every strain can cause long COVID.
Now, doctor, we just heard an anecdote about another doctor telling a patient that long COVID wasn't really a thing. What do you say to skeptics?
Well, what I say is that the data is pretty clear. We have been studying the data on individuals who did have COVID, who did not have COVID, in very large populations. And there are very clearly different symptoms emerging among patients who've had COVID at a very different rate, meaning that after people have COVID, they tend to have more heart or cardiac issues. They tend to have more respiratory issues. We see that in the data. Now what we're trying to do is understand how many people who've had COVID does that actually affect? What's the prevalence? And then understand, why is that? What about the virus is causing those? So very clearly, the data tells us there's something going on. The purpose of the research is to better understand what that something is.
Thank you, doctor. That was Dr. Sean Granis of the Regenstrief Institute in Indianapolis.